Nephrotic syndrome is a condition where the body starts losing protein through the kidney filters. There is a defect in the filter, and the amount of protein leak can increase from 3.5 grams to up to 7 to 10 grams per day. This condition is called nephrotic syndrome, and it is associated with low serum albumin, increased lipids, and swelling of the feet and other parts of the body. There can be puffiness of eyes, there can be distension of abdomen, and there can be pitting over the shins and legs. It is generally idiopathic, and the commonest causes are minimal change disease, focal segmental glomerulosclerosis. In adults, membranous nephropathy is a very important cause of nephrotic syndrome. Some patients can be suffering from lupus nephritis, also have nephrotic syndrome. Nephrotic syndrome can affect all age groups. In small children, even from 1 to 2 years up to 12 years of age, they have very commonly been observed to have minimal change disease or FSGS. In adult population, 20 to 40 years of age, membranous nephropathy is very common. In females, lupus nephritis is being seen. And in elderly, again, membranous and MCD is seen commonly. So any age group can be affected by nephrotic syndrome. Generally, patients with nephrotic syndrome have swelling over feet, which increase from the ankle to above up to the thigh. There can be frothy urine. That is, whenever they pass urine, they feel that the urine is frothy, like soapy water. There can be puffiness of face, swelling over face when they get up in the morning. Secondly, they can have blood in urine. They can have increased blood pressure, weakness, swelling in the abdomen, and they can complain of fatigue. Nephrotic syndrome is very much treatable now. We first need to do a kidney biopsy in which we find out the exact cause of nephrotic syndrome. As I mentioned, there are 4 to 7 causes of nephrotic syndrome. We need to pinpoint which one is affecting the kidneys. And then once we have the diagnosis, we can treat it with medication. Most of the nephrotic syndromes respond very well, and the patient can be free of medicines over 4 to 6 months, and he might never have symptom again. Some nephrotic syndromes trouble the patient and they can recur again. So in those cases, we have secondary medicines as well, which can prevent relapse. Nephrotic syndrome, patients lose a lot of protein in their urine. So we need to replace that amount. For instance, if you are losing around 7 grams of protein in urine every day, you need to replenish that with diet. Otherwise, if we keep on losing that much amount of protein, there will be malnutrition. So taking excess amount of protein is very helpful in these patients. The other thing is they have lipid profile derangement. So we need to control on our lipid intake, fat intake, and increase the protein intake. Thirdly, there is excess water retention in the body due to loss of protein in the urine. So urine output is reduced. So which can be managed with medication along with restricting excess fluid. Untreated nephrotic syndromes can cause infections. If there is excess swelling, there can be breach in the skin barrier and cause infection over legs or abdomen. The other thing is there can be clotting in the body. Since excess protein is lost, the anti-clotting factors are also lost. So there can be deep vein thrombosis. There can be bleeding from other sides, which are the major complications in nephrotic syndrome. Nephrotic syndrome is generally idiopathic you or genetic. You are born with these genes, but there are few preventable causes as well. Like if there is excess painkiller intake, uh, some other indigenous medication whose quantity or whose uh, consumption we are not able to quantitate, it can cause nephrotic syndrome. Cancers are a cause of nephrotic syndrome, and different medications have been associated with nephrotic syndrome. If you have been on persistently on some medication which may be a cause of nephrotic syndrome. We need to look at that.